Hi everybody, my talk tonight is about Dr. Tweddell, and it's called It Takes a Village. This is something I heard Dr. Tweddell say many times, referring to all the members of his team and how they interacted to come to the final goal of trying to help these kids with complex congenital heart disease. I think we can all agree Dr. Tweddell was an amazing surgeon. He was very creative and had the ability to think on his feet in situations that were really very life-threatening and scary and come out with a winner at the end of the day. He was a pleasure to work with and had a great sense of humor, and working with him in the operating room was always a treat. It was always both fun and hard at the same time, but you come away with it at the end of the day with a feeling that you made a positive impact on a patient's life. The other thing about him in the OR was that he was kind of like a Swiss Army knife in that he could do everyone's job. And I know the anesthesiologists were pleased that he could do their job. And I'm sure the intensivists were also happy that he could do their job. And the cardiologists, of course, they were pleased that he could do their job and be an echocardiographer as well. I know Nancy appreciated his help because certainly she needed his help to do her job. So all of these things made for quite a fun time back in the days when we worked together. Now, Dr. Tweddell was also a leader, and he was one of these leaders that led by example. Leaders that lead by example do this not because that's how they're trained, it's just who they are. You know the people I'm talking about. These are the kind of people that you want to hitch your train to. These are the people that you want to be like. Kind of like Tom Sawyer when he was whitewashing the fence. He was doing a cut down one day. I came up and he showed me what he was doing, and I wanted to do that. So he showed me how to do it, and I was then doing the cut downs, and he was watching, and then we were all doing the cut downs. He was that kind of leader. He made us want to be like him, and we also strived to do it to his standards. Two other things about him that were unique in surgeons, and that was he was patient, and I've never met a surgeon before who was truly patient. I'm not. I don't know anybody that is, but he was patient, and he also didn't seem to recognize the clock as an entity. Time did not enter his thinking process as far as what he was doing. So he was unique in that way. Dr. Tweddell was very much a team approach guy. He was the kind of person that would like to have all the team members comfortable expressing their opinions and being involved in what they want to be involved in. And it was also a no-blame environment where if something went awry, we weren't going after the person involved. We were trying to look at the root cause and figure out how we can prevent that in the future. He would try to maximize people's skills and interests in an effort to increase their output as team members. He also would consider ideas that other people might come up with. Anyone on the team could come up with ideas. You don't have to be a surgeon to come up with a surgical idea, believe it or not. And believe it or not, he would sometimes use them if they were deemed a possibility or considered appropriate. So it was a nice way for everyone to feel involved. Dr. Litwin founded the program in the 70s. The old hospital was downtown, and it looked a little different than this. He developed and grew the program with hard work, innovation, and a fellow, a PA, and a nurse clinician. As time went on, we got bigger and bigger. They eventually hired a second PA, that was me. And then as Dr. Tweddell came on board in the 90s, we pretty much picked up from there and took it on farther. And as the years went on, we continued to grow. And when I think back about the Christmas parties and anytime we got to get together, Dr. Litwin and Dr. Tweddell, they'd get up at the Christmas party and address the team, and the common theme was, it takes a village. It's the team that makes this work. We all work hard, we're all dedicated, and they always thanked the team, and frequently by name. And that was really very nice. Dr. Tweddell came here directly from his fellowship training. He was very well trained by Dr. Spray and other surgeons who already had made a mark in the treatment of hypoplastic left heart syndrome. As Dr. Tweddell's, as he refined his surgical skills and his techniques, he utilized some unique surgical approaches that became essentially used worldwide to help improve the surgical part of the task. And in addition, they meaning the powers that be, involving Nancy and Eckert and George Hoffman, Todd Troshinsky, and others, they worked on the physiology and the management of these kids post-op. With all of that brain power behind this, it really made for a fine meshing of all this knowledge, which allowed Children's Hospital then to enjoy some of the very best results in the country for treatment of this very challenging defect. As we started doing more and more of these cases, what we found was we were in fact leading the world in survival for this very challenging group, and we became world renowned for that. Further refinement was provided by Dr. Frommelt and Nancy Rudd and Peter and Michelle Frommelt and others, and they helped work on interstage survival, thus improving our results even further. And this was really a very exciting time, and it was quite a ride to be on, and difficult, long hours, a lot of work, but it was really quite a heady time, one with lots of excitement and lots of accolades. We can't forget the unsung heroes, however. The team consists of not just us, but those we leave at home. Jim, Bert Litwin, they would remind us when we were walking out to thank those at home for loaning us out to the hospital and the cause. Being at home alone while your spouse is at work, that's no fun. The kids want you there at their soccer practice or at their birthday party, but you're not always able to be there. It's just as hard at home for them as it is for you at work. So don't forget about them, and when you're hard at work, remember your wife or your husband or whoever it is might be sitting at home having dinner alone in the dark, and that's pretty hard. When you go to bed at night alone and you wake up to a kiss, and that kiss is your spouse leaving to go to work again, you know the story. Anyway, thank you, Susie, thank you, Mary, thank you, Judy, and all the other wives, husbands, sisters, brothers, and kids for loaning us to the cause and to the children.